First Vice President at the Ghana Registered Nurses and Midwives Association, Ora Samo Akogo, what Timmy Ababekasa about a nurses for strike here. Nano Timmy Eto Jasiciano, or more a suspended strike here. Say, I shani muse. Senior Moka say on the 14th of June. Ombe resume ejumana on the 26th of June. Sebedo na enhihye ban ene omakono omuntimi endi so a omusan edomojuman ebeto na strike no omusan so akobie na opanyin ni nsema odi tuja enina ene se time a na ono ewo so no na chese ensem bia na aban ekachiro especially ministers no ekachiro about allowance ni health issues problems are omo face o nyina ne say omo okachiro omo anaso omo report the ministers na asema okachiro omo ne say omo ntomobo ye be ya amamu de jimidi ye be ya amamu ba ni nyina no onko enkoka nchire ne members ne say ministers no me kachiro mo tose mo na abibia no we leader nti no mo fele positive mo hu say oh very soon na aban beba be ye de mo ba strike ya esi ye no mo hu say dada ni na sana na aban no de ye mo ministers a mo betwem na sa mo tose mo science strike ni de senior president no abeka say so omo anye nhihye ni year on the 26th of June no omo san so ebe resume strike no sa anomo be no ebusia NTA senior vice president etimi edetu jamai.
Oh, the minister is their friend. They just go and then they are putting they are deceiving us. So it will get to a stage where even the membership doesn't believe whatever you are saying. And when it gets to that point, there is so much pressure on you to demonstrate that you are really committed to their welfare.
So did you exhaust the engagement? That's the question.
When you say exhaust, it is, there is nothing like you have exhausted the engagement. Whether the engagement were bringing out something that we can take away and go and present to our members. That is where the issue was. And for the minister, he was available for us all the time. When we strike a meeting with him, he's always there. But in the meeting, it is just pure assurance. Trust me, I will do it. You can't go and tell your members that the minister said we should trust him.
Tell us this. How did you come to the point of declaring a strike? To have in excess of 120,000 nurses on strike, about 70% of the nurses in this country.
Yes. As in our earlier discussions, we started engaging the ministry since January. We're told we should hold on till the government structure is put in place. And at that time, our chief director then was always in constant engagement with the chief of staff who was at that time already appointed. Now, we waited, the ministers were appointed, vetted, the budget was read. So when they appointed our minister and we met him, he said, oh, we should just give time, they will read the budget. Then we waited. After the reading of the budget, we went back. There's pressure on us. Let us see how we can resolve this matter before it goes out of hand. The minister continued to tell us that he wants us to trust him. And then he felt we're just being unfair to him because he was new in the ministry. But that was not the case. People we signed the conditions of service with, that is the other health professionals in the health sector, and are enjoying their own. So why should that of nurses and midwives continue to delay?
Right. So if I may ask this question then. So these demands that you were making, 13th month salary, 1,000 annual uniform allowance, 180 liters of fuel, 8% non-basic allowance, government-funded license renewals. You had been giving the impression that your situation will be captured in the budget. Now we are told that it will cost $2 billion if this has to be done, and that has not been factored into the budget. Does that sound like a betrayal to you?
It is, because we're told we should wait for the budget to be read before. So how come that it was not taken on board? And if you heard the news conference that was organized, and these are some of the things that makes our members very angry. The government spokesperson said at the time they were making the budget, the conditions of service were still under negotiation. That is factually inaccurate. And we're expecting that before he could even speak to those issues, he could have gotten hold of the document, which is readily available. It is now everywhere. We didn't even want this document to get into the public domain, but it is everybody is now having it as newspaper.
But the conditions of service had been agreed to by a previous government, right?
Yes, please.
Okay, so you will understand that they really meant it when they said you should give them time, because you were rushing them. They had just come into office.
You see, if they had given indications from the beginning that there was going to be a challenge, in that case, we wouldn't have been going to our members to give them assurance that, look, let the government set itself finish. Let them read the budget. But why should we talk about the durations of the government? Are we saying that since the government came in, they have not expanded in other sectors or in other areas? It is only the nurses and midwives' conditions of service. That is the only one that our employers feel they cannot implement. Okay,
Mr. Akogo, so now you have suspended the strike. A lot has gone on, which may have been unnecessary. If somebody had lost their lives, all this would not have been important. Now, you are scheduled to have a follow-up meeting on the 26th of June. What must happen on the 26th of June for you not to resume the strike?
Thank you very much once again. And let me use this opportunity to thank the Parliamentary Select Committee on Health, and then more especially the majority leader who joined the team and were able to come out with something fruitful. We put out some understanding, and the understanding was we put them in the hierarchical order. It became clear that we're not going to get everything this time, but something will come out of it. The rest will be implemented next year. Now, to tell you the sacrifices that we have made as leaders for the sake of the country, there would have been arrears from July 2024 to date. We have decided not to bring the arrears on board and just start and move forward so that we will not have the issue of backlog of money to be paid. So if the people of Ghana are listening to us, That is how reasonable we are. That is how compassionate we are.
But Mr. Akogo, you brought this upon yourself, didn't you? Because your other colleagues managed to get theirs, and they are enjoying it, except your group. Was there not a court process that halted it?
Of course, yes. But the court process truncated through out-of-court settlement, of which the judge adopted as the court adopted as its judgment. And in January, we had applied for the judgment and distributed it to all the institutions that were being prohibited from implementing the conditions of service, because the documents was already in the Ministry of Health and Ministry of Finance. Fair wages and salaries also have their own. In our own way, we made a follow-up even up to the Ministry of Finance. They were going to sign it just like the other unions own that they have signed, but for the court order. Now, these are our own members.
I need to get to the studio and speak to my other guest on the program. I wanted you to be direct with me. The government says there is a need for $2 billion to be able to cater for you. That has not been catered for in the budget, so you must wait for 2026. Do you think this is going to change when you hold the next meeting on 26 June?
We believe so.
If it doesn't change,